The latest on the coronavirus outbreak. New quarantines are in place in California this morning after what's suspected to be the first U.S. case with unknown origin. The female patient is battling the virus despite no recent foreign travel or contact with another infected person. So Carter Evans is just outside UC Davis Medical Center where she is being treated. So Carter, this case could actually have bigger, wider implications.
A lot of implications, and there is an issue because there's a lot of uncertainty surrounding this case. Now, health officials here insist the risk of acquiring the virus in the area remains very, very low. Still, they say this kind of transmission makes containment especially challenging.
This is a random individual in a community of 450,000 people.
Health officials say the patient first came for treatment here to North Bay Vaca Valley Hospital. After her symptoms worsened, she was brought to UC Davis Medical Center, and it was days before she was diagnosed with coronavirus.
Which means that there were multiple healthcare personnel who were exposed to the individual. Some of them are under isolation. Some of them will be under quarantine.
Both hospitals are near Travis Air Force Base, where hundreds of Americans returning from China and Japan were quarantined. But officials found no connection between the woman and anyone at the base. They are trying to find everyone she may have contacted.
How many potential contacts are you tracking right now?
I can't give you those specific numbers, but I can tell you that they continue across the full spectrum from the individual's home all the way through the hospital system.
California is monitoring 8,400 people for the virus, but the governor says the state had just 200 coronavirus testing kits. He says federal officials are promising to send more.
I'm not going to politicize this moment, and I'm not going to point fingers. We have had a very strong working relationship with the administration.
The federal government is working to increase testing capabilities nationwide. At least 40 labs are now able to test for coronavirus. That number is set to more than double to 93 by Monday. After the Dow Jones closed down more than 1,000 points Thursday, President Trump tried to ease investors' fears about the virus' impact here and abroad.
We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows.
All right, so CBS News has confirmed that a Department of Health and Human Services whistleblower has actually filed a complaint. Can you tell us any more about that?
Well, that complaint alleges that workers responding to American evacuees from China just weren't prepared. It says those who monitored people at 2 military bases were improperly deployed and did not have the necessary training or equipment. Some even worked without full protective gear, and one took a commercial flight once the work was done. Now, one of the Air Force bases where this apparently happened was in the same county where this patient here became infected.
Okay, so what about medical masks? We've started to see people popping up just here in New York wearing these masks. And as I understand, there's a bit of a shortage. Are there enough masks for the people who really need them? And should people be wearing them?
Well, there is a shortage. If you go to any stores looking for those N95 masks, which, by the way, are the only ones that can be effective, they are very, very hard to find right now. In California, they say they have a stockpile of millions of masks for medical workers, but they're expired. So they're now seeking permission to use those masks anyway. This could become a concern as this disease progresses.
Indeed. Carter Evans, thank you so much.